Ni ukusanyaji ambao ulikamilika wa sahihi za BBI na viongozi pale wanazidi kuzungumza. Lakini nitakuwa na kuregesha kule muda si mrefu. Naomba tuangazie taarifa moja hapa ambapo chama cha uuguzi humu nchini kinatoa msimamo wake kuhusiana na mgomo wa wafanyakazi wa afya wanatarajiwa kuanzia wiki ijayo. Wafanyakazi wa afya wamekuwa wakilalamikia hatua ya serikali kupuuza matakwa yao.
Focusing on meeting the demands that they accept that are very legitimate, they have decided to continue with the rhetoric that they have actually fed us since the inception of this pandemic. If you saw the statement from the Ministry of Labor yesterday, you will understand the rhetoric we are talking about. They have invited us for a tripartite meeting, and they are doing the same thing they have done over the past 2 occasions where we have had to go before them on mediation or arbitration. They are telling us we have to segregate the issues and then we let them handle. And that is the same thing they said in May when we had our first strike that we suspended, and then in August when we actually suspended the second strike. Now they're asking us to accept that we can let our vulnerable health professionals to continue dying in the guise of patriotism, that patriotism now has become a suicide attempt for the health workers. And we are telling them that we are not ready to commit suicide, that we shall not accept, let Victor Tioni be the last one to suffer and to die out of neglect of the government. And our irreducible minimums we gave them, they are matters of life and death. And we want to repeat again, you cannot negotiate on matters of life and death. What is so difficult with a government just giving a policy directive to exempt people with pre-existing diseases, people who are aged and pregnant from duty? What is so difficult? And now the CS has to come out and tell us to give them more time. Is it the pen or the paper they are lacking? Because we can provide them. And this is the most unfortunate thing that I'm saying, that there is no goodwill from the government. They want to appreciate us with rhetoric every day, but they do not want to do tangible things to ensure that we are not dying and that the welfare is taken care of. And I think it's time Kenyans should be able to ask their leaders, because you are the ones who elected them, why they are letting you not to enjoy your right under Article 43. Just picture this situation. Number one, you are not given the right PPE. The right PPE according to the rationale use of PPE guideline by the Ministry of Health. Anybody working in a consultation room, they are supposed to have at the minimum an N95 mask and a face shield or goggles. That is from the Ministry of Health. Even in the facilities by the Ministry of Health, that is not happening. What are we expected to do? Then once you fall sick and you go to hospital, you actually don't have a medical cover. And now we have to contribute. Like now we are contributing for our colleague in Nandi, a bill of 2 million. And we want to tell Nandi County government that this one, we are not going to pay. If they are not going to offset that fee, we shall marshal our people. And if they are going to detain the body, we shall get it out ourselves. We are no longer going to take their rhetoric. And if they are not going to give solutions by Sunday evening, then it is very unfortunate that we are going to have to go on a countrywide strike at a time of pandemic. And sometimes it is very disheartening, because even for us, we would never wish to leave our people to suffer. But how can you be able to take care of people when you are dying yourself? In fact, it will be negligence on our side when we don't come out and ensure there is oxygen in that facility, like the lack of which has even led to death of a member of parliament in this country. And as if that is not a lesson enough, you can see what your leadership said. They want helicopters to be airlifted to where the oxygen is, instead of taking oxygen to that population. So they are telling you, you can continue dying, they only care about themselves. And lastly, the CS said, addressing demands cannot be a switch on and switch off. And I want to agree with him, and I want to advise that we have the solution. And we have advised them on the solution. The solution is to have a health service commission that manages the welfare of health workers, so that then there is no switch on and off. They will be full-time and all the time looking at the welfare of health workers, and that will mean that you will not be seeing these strikes on very basic things that they can be able to take care of. You can see the Teacher Service Commission, in a very short while they were able to negotiate with the insurer, and teachers are covered against COVID, when actually we as the frontline workers are not covered. And that is the importance of a health service commission and what it will bring to the table. Allow me to invite our General Secretary to read the statement, and then we are going to have the chair for the Kenya National Union of Nurses to give his remarks, as well as the other leaders that we are having here. The GS.
Thank you, Chair. Members of the press, my name is George Gibore. I'm the General Secretary, Kenya Union of Clinical Officer. Our press is entailed and mean to inform Kenyan that our forthcoming strike for the healthcare workers, the clinical officer, the nurses and the doctors by large is still on. Reason being that our issues have not been addressed. I will read the statement. That following our strike notice that was issued on 23rd of November 2020 with the clear demands on the safety and welfare of clinical officers and other healthcare workers, we wish to state as follows: that despite the government receiving our demand letter on 16th of November on the issues we wanted them addressed, and later on received a strike notice after 7 days, they have not done anything. Indeed, they have done very little to address our grievances to avert the looming strike. It is true that during their press briefing, the government continues appreciating our services, and of most important, the myriad challenges that the frontline healthcare workers are facing during this COVID-19. But doing nothing to motivate them and safeguard their life. We acknowledge the effort of the Cabinet Secretary, Minister of Labor and Social Protection, for taking the leadership to bring parties together, that is the Minister of Health, the Council of Governors, the NMS, the unions, that's the Kenya Union of Clinical Officers, the Kenya National Union of Nurses, and the Kenya Medical Practitioner and Dentists Union, to address the concerns as raised on the strike notice. Unfortunately, up to date, there seems to be no solution to avert the looming strike that is set to begin next week on Monday. This means that the time that was given to the government did not mean anything to them, and hence the government is planning to go on strike. More unfortunately is the fact that the press statement by the CS Labour, Honorable Simon Chelugui, confirmed to Kenyan that the government has no intention to resolve the looming strike, a health crisis, with the utmost urgency it deserves to safeguard the life of Kenyans and healthcare workers. We wish to remind him that this is a matter of life and death. They are asking us to accept that we continue dying as they continue with the same rhetoric they have used since the onset of the pandemic. That we have so far lost 9 clinical officers among other healthcare workers. Of the recent past, being one Mr. Victor Kipngetich Tioni from Nandi County on 2nd December of 2020, and indeed we say may their soul rest in peace. In the same line, we as the clinical officers, we have got a number of 763 infected by COVID-19 and testing positive, those who are both serving in the public and the private sector, a majority of them being in the public sector. Up to date, we have around 37 cases which are active for clinical officers. Actually, this is because we were not able to get the other report from other parties. That once infected and hospitalized, clinical officers and other healthcare workers have catastrophically suffered financially without any support from the government, including the late Victor, who left unpaid hospital bill of about 2 million after 2 weeks of admission and hospitalization at St. Luke Hospital in Eldoret. That it is our feeling that our sacrifice to serve in a hazardous environment is not being acknowledged and appreciated. They now want to twist us and force us to commit suicide while in line of duty under the guise of patriotism. As a matter of fact, it is true indeed to say that a majority of the healthcare workers who have lost their life are within the vulnerable group. That the surging cases and infection amongst the healthcare workers is actually attributed by the fact of lack of training on safety measures, on COVID, and inadequate supply of recommended PPEs and indeed substandard PPEs within the medical fraternity. That up to date, the UHC staff have not been paid for over 6 months now, and including the interns who are serving in the same dire situation. Indeed, during this very risky and very needy moment, the healthcare workers and the clinical officers in this aspect continue serving with a health risk allowance that is not commensurating with the risk that they are involved in. That healthcare workers have been feeling demotivated because they do not have a comprehensive medical cover, life insurance, and actually a structure to ensure that they are compensated once they suffer or rather lose life while in line of duty. That indeed at this moment we continue seeing the government engaging healthcare workers under irregular contract that contravene the provision of the Employment Act. We wish to reiterate as follows, that meanwhile, the strike as planned is on and shall only stop when all our demands that entails safety and welfare of healthcare workers are addressed comprehensively. That, however, the union remains available, as we have always been, to be consulted on matters of safety and welfare of healthcare workers, and indeed to resolve the forthcoming issues which involve the strike. We wish to relay our apologies and concern to our fellow Kenyans who rely on public health services, and reassure them that we are doing this for their good and for their prosperity and the growth of the public health sector. Yours in solidarity, Kenya Union of Clinical Officers and the Kenya National Union of Nurses, among other healthcare workers. Fellow Kenyans, let me say this, that this is our short statement, which confirms that we have given the government enough time. Since the onset and indeed the inception of the COVID-19 in this country, we have constantly engaged the government in the manner that we will wish them to engage us and practically address the issues that are affecting healthcare workers, and indeed to ensure that we are able to curb the spread of the COVID-19. But the government continue to ignore the issues.
Na mtazamaji, wahudumu wa afya pale ambao wanazungumzia hali yao katika sekta mbalimbali za kuhudumia wananchi kuhusiana na swala hili la COVID-19, ambapo wanasema kuanzia siku ya Jumatatu basi watakuwa wanagoma. Mtazamaji, hebu turejee